This is Dr. John Bardini. He's been kind enough to sit down with us today. He's a doctor of radiology. Can you tell us a little bit about yourself, Dr. Bardini?
My name is Dr. John Bardini. I am a radiologist. I went to medical school at the Rutgers, New Jersey Medical School in New Jersey, and then I completed a diagnostic radiology residency at the University of Chicago, followed by a fellowship in interventional radiology, and then a second fellowship in musculoskeletal radiology at the University of Michigan.
Why did you choose to specialize in radiology?
I chose radiology because it's a field that encompasses all patients, and so you are able to see all different specialties. All specialties will rely on you for imaging, so you'll see OB/GYN patients, surgery patients, orthopedic surgery patients. I also chose it because I enjoy technology and using technology to help patients through imaging. And the field has dramatically changed over the years in terms of technology, and all of these things contributed to why I chose radiology.
What do you typically do in your office?
I actually practice what's called teleradiology, so I will read radiology studies that are digitally sent to me over the internet on a computer with multiple large monitors, and I will read studies that are performed all over the country that are sent to me, and mostly x-rays, CAT scans, ultrasounds, so really all the different imaging modalities.
What roles do x-rays play in your job?
So this is an example of a radiograph. This is a radiograph of the right foot in a patient, and as I mentioned earlier, years ago we would actually have a film, physically a film and a view box. The view box would be lit and you would hang the film. Now, obviously it's all digital and you can see it's on the screen here, and I'm able to window it and really kind of look at the soft tissues, and I'm also, if I'm not sure if there's a fracture and I want to zoom in a little bit, I can do that, and I can pan, and all these things have really helped us evaluate any study. In this case, like I said, we're looking at the foot, so if this is a trauma patient, I'm looking for any kind of fracture, I can really zoom in and really get a good look at it, and then I can zoom out and play with the soft tissues there. So this is a typical example of how most radiologists are reading x-rays today.
How does the current technology make your job more efficient?
Current technology has really improved my efficiency. Now everything is done digitally. So before, when you would acquire an x-ray, you would actually physically have a film that you would have to hang and look up at a view box. Now everything's digital. For me, it's tremendous because I actually work remotely. I work out of a home office, so the images are sent over the internet, and obviously that's a breakthrough.
Why are lead aprons important when being x-rayed?
There's a philosophy in radiology called ALARA, which is an acronym for as low as reasonably achievable. So that is basically the concept that any radiation is too much radiation, so you always try to keep it to a minimum. So lead aprons will block x-rays, and basically that's because even though it's a small amount of radiation, lead aprons are often worn by physicians who are in the room because they're going to see multiple patients, whereas a patient might just receive, they're just experiencing one study. But also we will put it on younger patients, put it on their lower body to shield sexual organs, protect that, because there is a risk with radiation. Again, there is a certain threshold or value that you want to keep it below, but most hospitals and imaging centers will stick to that ALARA concept where any amount of radiation is too much. So it's just to minimize radiation to the body.
How does an x-ray imaging machine create a physical x-ray?
Years ago, they would have you would have a cathode ray X-ray tube, and that would shoot the X-ray beam, which was the form of energy was called a photon. That would be, you would place a plate, what's called film screen, behind the patient. Let's say I'm imaging the shoulder, I would have a plate behind the shoulder. Now, what we have is a phosphor plate, and there's no actual film that's produced, it's all digital. So that information is, basically the X-ray will pass through, and anything that blocks the X-ray, like a bone, which is very dense, will show up as bright on an X-ray, whereas things that aren't, such as the soft tissues or air, will show up as dark. So as the X-ray beam is able to penetrate, it will change kind of the shading of the image. And so that's what we use. And knowing the anatomy and what the bones are supposed to look like, and the soft tissues are supposed to look like, we can see if there's a fracture. We can also see if there's a tumor or something going on.
Given all the advances in imaging technology, do you think X-rays will eventually become obsolete?
No, I don't think they will become obsolete for numerous reasons. Number one, there is information that's acquired from a regular X-ray that is better demonstrated than on a traditional CT scan or MRI in particular. So the other thing is it's very easy to acquire, it's quick, it's inexpensive, and as I mentioned, especially for fractures, and especially for things like tumor, to decide whether or not there's any calcification in the tumor. So there will always be a role for radiographs, in my opinion, mostly because, as I mentioned, it's quick, it's inexpensive, and there's still plenty of information to be gleaned from a regular X-ray.